There may be a time when we have a constellation of mutations that arise in a variant where our vaccines actually lose their potency. The Delta variant is of great concern for us because this is one of the variants of concern that is circulating around the world. Our ability to understand where this variant is spreading is dependent on the sequencing that is available around the world. And so far, we know that 92 countries have the Delta variant that is circulating, 80 countries of the B1617.2, and an additional 12 countries which have the B1617, but they haven't further subtyped it. We don't know the sublineage that's circulating there. This variant has demonstrated increased transmissibility. It is more transmissible than the Alpha variant, which is the B117, which spread rapidly around the world. This Delta variant is spreading rapidly around the world as well. If it has an opportunity to spread, given that we have increased social mixing, the relaxation of public health and social measures, or the inappropriate use of public health and social measures. And what I mean by that is relaxing too soon or too quickly. It doesn't mean the lifting of a lockdown or an all or nothing. It means that adjustment isn't done as carefully and controlled as possible. And given that we don't have full vaccination, it will spread. We know that there's a recent suggestion from one study in Scotland suggesting that there's an increased risk of hospitalization, but that is some preliminary work that's done from one country, and that needs to be further studied to better understand impacts on severity. We don't have an indication of increase in mortality from the Delta variant, but again, we're still studying this variant as it's circulating around the world. In terms of vaccine effectiveness, we do know that all of the variants of concern, including the Delta variant, the vaccines remain effective against severe disease and death. And so this is a very good sign, but we need 2 doses to be administered to have the full level of protection. We do see reduced efficacy with the 1 dose, and so we really need those who have received their first dose to receive that second dose. What is really critical is that our public health and social measures still work against the Delta variant, but they may need to be administered for a longer period of time to be able to have the same level of control as we've seen for other variants. And if we have the uneven amount of tools around the world, some countries only have public health and social measures. Other countries have public health and social measures plus vaccine. And so it's not really a fair fight against this Delta variant. But the good news is that the public health and social measures, the individual level measures, hand hygiene, avoided crowded spaces, wearing of a mask, making sure you have clean hands when you put on and take off a mask and dispose that mask of properly, disinfect that mask properly, making sure that you have good ventilation, spend more time outdoors as opposed to indoors in settings where you're able to do so. All of those measures remain incredibly critical at reducing the spread. And of those countries that have access to the vaccine, people need to have their second dose to have the full level of protection. So we're still learning, but we are concerned about the Delta variant that is circulating. If it has an opportunity to spread, it is really spreading quite rapidly in a number of countries. There is a recent study that came out in the Lancet that was published that looked at the reduced titers neutralization from the Alpha, Beta, Gamma, and Delta variants, showing a reduction in neutralization on the Delta variant, not as much as the Beta variant, which is the variant that was first detected in South Africa, the B1351, but still a reduced efficacy. Having said that, these vaccines are still highly effective. They produce enough antibodies to protect against severe disease and death. That's a really important message that we want to make crystal clear. while we are seeing some reduced efficacy, they are still effective at preventing severe disease and death, including against the Delta variant. But as I said previously, we need individuals to receive both doses. And I know that's a challenging thing given we have the uneven distribution and the limited number of vaccines. But if you have received your first dose, please go back and have that second dose when it is offered to you. This is about when it's your turn and getting that vaccine, while at the same time donating vaccines to those who need it most. The goal of COVAX, the goal that WHO has been saying around the world, is that we need those who are most at risk for severe disease, those who are most exposed, our frontline health workers, to receive those vaccines to be protected. And so there are a lot of studies that are underway, John. We're working with a global network of scientists through our R&D Blueprint for Epidemics, through all of our technical networks, through academic partners, to be able to get these studies underway and to look at studies in the lab, to look at real-world efficacy studies as well. But this data is coming in fast and furious. And it is really interesting to see the information coming in, and to WHO to be working with partners around the world to consolidate that, to look at what does this mean for our vaccines now, and in terms of next generation vaccines, the vaccines that will be produced into the future. Good news is, so far, the vaccines work against the Delta variant, but there may be a time when we have a constellation of mutations that arise in a variant where our vaccines actually lose their potency. And that's what we want to make sure that we prevent. So as much as we can, the best prevention is preventing infections in the first place. So again, vaccines are incredibly powerful, but we have other tools as well. Do what you can around the world, if you're listening, to prevent yourself from getting infected, and to take all of the measures that you can to prevent any onward spread should you be infected. And so we have to get this message out of vaccines and not vaccines only.